COVID cases have been on the rise here since June, with more children and adults going to the emergency room for treatment. But doctors are not seeing an increase in this latest COVID wave taking lives.
Still, with people with cancer need to take extra precautions to avoid infection. And Meg Ferris has more on a special free kit to keep cancer patients safe.
People getting treated for cancer need to be extra cautious about catching COVID.
Not only is COVID an acute risk for people with cancer, it's also a long-term risk. So one of the biggest risk factors for long COVID is ever having had cancer.
And right now, researcher Dr. Michael Hoerger of the Tulane Cancer Center says the risk has gone up substantially in the last few months.
It's very bad out there. There's about 1 million infections a day in the U.S. based on wastewater surveillance data. Transmission's particularly high in the West and in the South.
And as you can see right here, Louisiana is one of the states with the highest rates of active COVID. In fact, 4% of people are infectious right now.
So Dr. Hoerger is the only one in the country leading a pilot project called CoviCan. He's distributing free kits to people with active cancer to help prevent one of the places COVID is spread, in the home, among family members.
Early in the pandemic, people thought that COVID was spread mainly through droplets by touching surfaces and then touching your face. And we now know that that's not true. 99.99% of transmission is through the air.
So here's what you get free: special fans with high-end filters to purify the air in your home, 5 rapid tests to catch it early, an educational booklet, and 50 N95 masks. These are the protective ones because they have no gaps. And just like plexiglass and the few-foot social distancing rule of the past, those regular surgical masks do not help because you're just breathing the regular air coming in through all the gaps. So, why are the new Omicron subvariants called flirt surging now?
Right now, people could view it as more infectious because a lot of people have not been infected in a while, have not had a vaccine in a very long while, and also people are not taking very many precautions. The CDC lowered the isolation policy to 1 day. A lot of people aren't testing anymore.
COVID can mean cancer patients have to temporarily discontinue their treatment, and their immune systems are not strong. And a vaccine for the flirt COVID variants is not due out until the fall. Meg Ferris, WWL, Louisiana.
The kits are for patients being treated for cancer now anywhere in the U.S., and we have details on how to get one with this story on WWLTV.com.